Hello everybody, welcome back. What is aortic aneurysms? It is an abnormal dilation more than 50% compared with the normal segments of arteries, caused by the weakening of the arterial wall. What are the causes of aortic aneurysms? 1. Hypertension. 2. Atherosclerosis. 3. Infection. 4. Trauma. 5. Hereditary or acquired connective tissue disorders. What about the clinical pictures of an aortic aneurysm patient? 1. That the patient with aortic aneurysm is usually asymptomatic. 2. He has pains. 3. He is ischemic. 4. He has thromboembolism. 5. He has spontaneous dissection and rupture. The true aneurysm involves all three layers, when compared to pseudoaneurysm is a sealed dissection. What are the different types of aortic aneurysm? 1. Fusiform, which is circumferential widening of the artery. 2. Saccular, localized outpouching of the arterial wall. What about abdominal aortic aneurysm? The abdominal part of the aorta. It is 3/4 of the aortic aneurysm. The clinical pictures of an abdominal aortic aneurysm is that the patient is asymptomatic, pain is steady, deep visceral, and in the lumbosacral region. Pulsatile mass more than 3 centimeters, a brutal medial or over the renal arteries. When is surgical intervention needed in the case of abdominal aortic aneurysm? When the aneurysm is more than 5 to 5.5 centimeters. 1. Second is an increase in size more than 0.5 centimeters within a period of 6 months, regardless of the size. Number 3. When there is chronic abdominal pain, thromboembolic complications, and an iliac or femoral artery aneurysm that causes lower limb ischemia. What is aortic dissection? Aortic dissection is the surging of blood through a tear in the aortic intima, which is one of the layers of the arteries, with the separation of the intima and medium, and creation of a false lumen. The intimal tear may be primary event or a secondary to a hemorrhage within the medium. 1 to 3% of the autopsy, 1/5 patients of aortic dissection die before reaching the hospital. Almost 1/3 die perioperative, before the operation, or around the operation. What are the types of aortic aneurysm? Type A, ascending aorta 85%. Type B, which is descending aorta distal to left subclavian artery. The origin 15% for type B and 85% for type A. What is a clinical picture of a patient with aortic dissection? The context of a patient with aortic dissection is that he is hypertensive, dyslipidemic, and a smoker. And or it can be one or all of these. Intense excruciating pain, typically on the posterior thorax, can be anterior, migrates distally to the sides. Syncope, a symmetric pulse in 20% of the cases. Diastolic murmur due to aortic regurgitation in 50% of the cases. Myocardial infarction, and stroke and renal failure. How can you diagnose a patient with aortic dissection? 1. With X-ray. 2. Echotransophageal. 3. CT scan. 4. MRI. What is varicose veins? It is dilated superficial veins in the lower limbs. What are the causes of varicose veins? 1 is primary affectation of the venous walls, determining dilation. 2. Venous valve incompetence. 3. A genetic factor is aggregation in the family. Varicose veins is more frequent in women. Pregnancy determines increased pressure in the lower limb vasculature. Estrogen weakens the venous walls. For the clinical diagnosis of a patient with varicose veins, there is a typical appearance in the orthostatic examination when he is standing. Thank you for watching and looking forward to see you in the next video with a new topic.